Nice to see all of you all again. And nice to have this respite between the torrential rains. So it feels good also. And as you rightly said, nice and sunny here in Goa. And I thought I'll come with an appropriate message that we have to be aware of when we have these dry spells between the monsoons. It also so happens that the 20th of August is observed as the World Mosquito Day. Now, you'll wonder why we are observing something for mosquitoes. Yes, it's just to kind of remind us that mosquitoes do carry a lot of agents that cause disease. In fact, mosquitoes are responsible for around 700 million infections every year. Every year, 700 million people get infected with some kind of disease that is transmitted by a mosquito. Now, it is observed on the 20th of August because many, many years ago in 1897 to be precise, Sir Ronald Ross in India itself, he's a British surgeon who was working in India, identified that the mosquito was responsible for the transmission of malaria. So you saw the malaria parasite inside the mosquito, and that's how we knew in 1897 that mosquitoes are responsible for the transmission of malaria. Otherwise, people thought it was transmitted by breathing bad air. That's how the name comes, malaria. Malaria means bad air. People thought that by breathing bad air, people would get malaria. But that was not true. It was the mosquito that causes this. And because of this, and because of the contribution of Sir Ronald Ross, we now know that mosquito were responsible, and Anopheles mosquito was responsible for the transmission of malaria. There are many mosquito-borne diseases. One of them that is really creating havoc in Goa at this moment is dengue. I've spoken about dengue before, but I thought on the occasion of World Mosquito Day, I speak again on that and highlight these points that everyone should be aware of so that you can prevent this from happening. And in case it does happen, you need to know what to do. And the message is in the word dengue itself. So I told you before that D stands for the diagnosis. It's important that every fever is a case of dengue unless proved otherwise. So you need to make sure that you go and get yourself tested. Now, these tests may not come positive on the first day. On the second day or so, it's likely that the test would come positive. But you need to keep in mind that fever could be dengue. The fever presents, it's usually high temperature. You may have rash with it. You may have body ache with dengue. You may have retroorbital pain behind the eyes. Now, these signs and symptoms may not always be there, but fever itself in today's world in Goa, knowing the outbreak, consider that to be dengue unless proved otherwise. The D of dengue also reminds us that we need to prevent dehydration because a lot of people come to us completely dehydrated. Irrespective of whether the diagnosis is made or not, drink a lot of water. You can drink ORS, drink a lot of water because you need to keep yourself hydrated throughout the day in order to combat dengue. So it's important to remember D for diagnosis. So get your test self-tested. Any of the health services, primary health centers can test dengue, and it's a rapid test that they do. But I told you in the beginning, it may not be positive, so it's important to do it on the second day or so. Till then, do consider yourself to have dengue and keep yourself hydrated. E of dengue tells us that we need to eliminate the breeding sites. Now, dengue mosquito, the Aedes mosquito that transmits dengue, breeds in clean water collected around your house. So it's very important to keep in mind these dry spells between the monsoons. These are the times that you can have this breeding taking place on a very large scale because you have all collections all around because of the previous monsoon. Water has been collected in coconut shells and broken buckets and bottles that's disposed out all around your house. And it's very peaceful for the mosquito to now breed. And you have a lot of these Aedes mosquito breeding, and they're day biters. They're very fierce biters. They bite and bite many people, and that's how you have these explosive outbreaks of dengue. Try to see that you can in order to try to keep your surroundings clean if you want to reduce the breeding sites, so what we call source reduction. I also advise people to follow what is called dry day. And dry day is not what you're thinking. Dry day is once in a week. Try to ensure that everything around you is dry. So empty all those buckets. Sometimes you have buckets to collecting water for your garden, etc. Just empty everything on one day. All the containers will be emptied. Now, why I'm saying once in 7 days, because the life cycle of the mosquito or the mosquito from eggs to the adult is 7 days. So within 7 days, if you interrupt the life cycle, they will not be able to breed, and you'll be able to have an Aedes free environment, which will prevent the spread of dengue. So D for diagnosis, D for dehydration prevention, E for elimination of these breeding sites. And remember dry day. N is to notify. If anybody has dengue, you need to notify the health authorities, because they can take appropriate action, and they will then know that where the site is, and because it's from a person with dengue, that dengue is going to spread to other people as well. So they need to know what to do. So you need to notify them. If you don't notify them, they will not know. From the health services, they do get notified, but if it's possible, you could also do so. G is to tell you to get rest. This is a viral disease. Antibiotics are not going to help you. So you need to take rest during this time. It's also important that, in dengue, the platelets drop. So get your platelet count done. The doctor that you will visit will get your platelet count done. So check what your platelet count is, and it has to be monitored on a regular basis. Rest, because in case you have any injury, there's a tendency for it to bleed, because your platelet count could be low. So therefore, it's very, very important to recover from dengue. You need to take rest. It is a self-limiting disease. The virus will be there. It will increase. You'll have fever for first 2-3 days. The fever will go off. Platelets may start dropping, and it will automatically increase. But during this period, the person needs to be supported to make sure there is no complication, because complications can be severe. You can get hemorrhagic fever, and that could be life-threatening. So it's very important to take care of the person during that time. You is to tell you to use mosquito repellents, whether you're using screens on your window, or you're using some sort of creams. Use them, use long sleeves, etc., to prevent mosquito bite, because if no mosquito bites you, you will not get dengue. So it's important for you to prevent mosquito bite. And E tells us that we need to educate people. Only when you educate other people, like we're doing now, will other people know about dengue, and they will be able to keep this place safe from dengue. So everyone makes that effort, we can fight dengue together. It's not alone the health services. It's not the policy makers alone. It is all of us put together. We need to play our part to fight dengue. So this is kind of my message on World Mosquito Day for you. Stay safe and enjoy the season.